So you know the question?
Somehow. Dr. González, welcome to Greece.
Thank you.
It is a great pleasure having you here, sharing with us your experience and your knowledge.
Pleasure is all mine.
How do you feel every time that you have to go abroad and lecture internationally?
It's a big effort. But it's worthy because coming here and being attended as perfect, as good as Panos and all the people has attended me, it's a great pleasure. So it's a big effort, but the effort is worthy. And it's a lovely experience to share knowledge with my colleagues.
How did you decide to become a periodontist in the first place?
After finishing the dental degree, I wanted to work on surgery, but being a periodontist is like holistic because you do gums, you do bone, you treat all the periodontal aspect of dentistry, and actually periodontology is the base of dentistry, of the dentition. That's why I decided to go to that field.
The way that you practice, is it based on university-based knowledge or is it something that you continuously learn the way that you practice?
That's an interesting question because when you finish your dental degree, you think that you know everything. Then you go to the program and you are 3 years studying periodontology and you think that you know everything. But after 1 year you realize that you don't know as much as you think. And you need to keep studying and practicing and studying and learning from others. And that's why I think I never stop learning. So what I learned in the university was kind of a beginning. Then you have to walk the path. So the university is only a beginning. You need to be in continuous education.
So do you follow established guidelines or do you prefer to criticize them and decide on your own what would be the best for your patient?
I take every case as unique. I have some guidelines as everyone in every field of work, but I like to have a plan A, a plan B, or even a plan C, depending on the patient.
When do you believe that somebody is ready and he masters a surgical technique?
It depends on your results, and you need to be aware that even if you are a master in a technique, you will have failures. But when we have failures, we have to fall and stand up again. So I think we are always learning. You never totally master something. You are always learning. The fundamentals are always kind of the same, but you are improving, you are inventing tricks that makes the difference. So in my opinion, you are never a total master. You are always learning.
Do you try new techniques? When do you believe that it's the time to change your protocol, the way that you practice?
It comes up in my practice because if I see a deficiency, I try to defeat that deficiency. So I decide to change when I see something that I can improve or that it's not working as good as it should be. So as I told you, we are always improving. We cannot believe that we have all the knowledge, because when I see other dentists on the stage and I'm seeing their conference, all I can do is sit down, see and criticize what I don't like, or see what I can learn from them. And if I can criticize what they do, I'm sure they can criticize some aspect of what I do. So if you believe that you are perfect, you are lost.
Some clinicians are very conservative and try to do things step by step. So they say one miracle at a time. Do you believe that there is a merit in doing things simultaneously, so many things together?
I think it depends on the case, because if you have a narrow reach, but you can place the implant, stabilize the implant in the perfect position, in my opinion, you should do the surgery simultaneous with the bone regeneration. The only way that I do a delayed procedure is when it's impossible to fix the implant in the perfect position if I have a big bone deficiency, so I go for the two-stage procedure, first the bone and then the implant. But as long as I can place the implant in proper three-dimensional position in one shot and the regeneration in one shot, I go for the simultaneous.
Would you believe that technology can help even in a 3D bone augmentation, so have something pre-printed before you go to surgery? That's a new trend.
It's a new trend. I don't do it because with the membrane or with the Curie technique, I do my own framework. So in my practice, I don't see the need of that. But if the dentist is not so accustomed to do regenerative procedures, it can be a good help. So it depends on your practice. I am fortunate that I do many bone regeneration procedures, so I'm always doing that surgery. But if you don't have that opportunity, it's a resource that I think the general practitioner can use.
What would you advise the clinicians that want to try new techniques, advanced surgical techniques?
Oh, they need to keep studying, they need to go to courses, and they need to start by doing easy cases, and when you master the easy cases, you go high and high and high and high. You cannot try to do a big 3D bone regeneration if you don't do well the simultaneous regeneration. And when you master the simultaneous regeneration, you can start with doing bigger cases with the pericardium membrane. And then when you master the pericardium membrane, you can go to the next step, to the next level, which is the PTFE membrane or the Curie's technique.
Dr. González, thank you very much. It's wonderful having you here.
It's a pleasure for me. The pleasure is mine. Thank you very much to all of you. Great team, great people. Thank you very much.